Thank you very much, Madam. Respected Chairman of the Indian Association of Mozambique, Mr. Binish Vanavati, my dear friends of the association, distinguished guests, ladies and gentlemen. At the very outset, let me take this opportunity to congratulate the Indian Association of Mozambique for having completed its anniversary, the first anniversary about 3 weeks back. It has been a very active year, and all kudos goes to the leadership of the association as also to each one of its members. It is also indeed my absolute honor and privilege to be meeting you all today. There are many amongst you whom I am meeting possibly for the first time. I apologize for this delay in our meeting since I've been working in Mozambique for almost about 3 months now, although I was down with COVID for a month during this period. Nevertheless, ladies and gentlemen, once again I place on record my deep appreciation and gratitude for being able to meet you today on this auspicious event being organized by the extremely active and dynamic Indian Association of Mozambique. Ladies and gentlemen, I call this event auspicious because I strongly believe and agree with the Vice President of the Indian Association of Mozambique, Mr. Malcolm, that health is wealth. It is our duty and responsibility to maintain our health and to stay fit to be able to fulfill our obligations towards our families, our professions, and also to ourselves. An unhealthy person due to personal neglect of health is a huge liability on our society and our families. We would be able to work optimally and deliver our best services to our professions and to our society only when we are healthy, both physically and mentally. Ladies and gentlemen, I however understand that in spite of our best intentions, many of us may not be having the privilege or the means to be able to afford regular medical checkups and also to cater to our niggles at their early stages. That in turn leads to serious medical complications. Many of us also suddenly fall seriously sick that need to be catered, for which enormous amount of financial resources are required. This is particularly true in a country like Mozambique, where the cost of living is very high, especially that pertaining to medicines and healthcare. We are aware that a lot of medicines and medical equipment in Mozambique are imported that necessitates private hospitals to charge exorbitant amounts to possibly cover their costs. Overall, ladies and gentlemen, the import of all this is that although health is wealth, and we understand it very well, the cost of being healthy is very high. This is despite the nature's gift to us of a pollution-free and pristine environment that we enjoy in this country. Ladies and gentlemen, it is in this context that the initiative of the Indian Association of Mozambique to offer affordable medical insurance scheme for all interested members of the Indian diaspora in Mozambique through a very consultative and democratic process is particularly laudable. The COVID-19 pandemic is spreading like wildfire in India at this moment. And I understand that it will strike in a cyclical manner in countries across the globe in the times to come. We have to learn to live with this pandemic at least for a few more years till we are totally vaccinated and immune. The necessity of possessing medical insurance to cater to this expensive medical treatment for COVID-19 pandemic can therefore never be overemphasized. Of course, such medical insurance cover would also help us to deal with other critical diseases and medical interventions that we may need from time to time. I therefore consider that the Indian Association of Mozambique has rendered a great service to all of us in addressing our utmost important need to cater to our health in Mozambique. Ladies and gentlemen, I hope that the medical insurance scheme would be of huge benefit to you in addressing your health-related concerns. I do not wish to delve upon the details of the medical insurance scheme that is being offered by the Indian Association of Mozambique. But I hope that all of you would examine it as per your needs and affordability and thus secure the means of a more effective and healthy living. Last but not the least, ladies and gentlemen, I take this opportunity to wish you and your families, including those back home in India, good health, safety, and wellness. I'm confident that being Indians, we are inherently resilient in the face of adversity and that we would overcome the challenges that we are confronted with as soon as possible under the sterling leadership of our Prime Minister, Shri Narendra Modi. Ladies and gentlemen, I want to take this opportunity to convey to you my willingness to meet you all and to address your concerns to the best of my ability whenever such occasions arise. I take deep pride in the success of the Indian diaspora in a foreign land, and I am happy that all of you are doing extremely well in life. Honorable Prime Minister of India, Shri Narendra Modi, while addressing the Indian community in Brussels in March 2016, had called upon the Indian diaspora as Ganadoot, the representatives of the people in Belgium, and had iterated his belief that a Ganadoot plays a more important role in projecting India's positive image in a foreign country than even the Rajdoot, that is the ambassador. I certainly believe in the words of my Prime Minister. I therefore once again congratulate you for the same and urge you to keep up the good work that you are doing for India in Mozambique, as also in your personal and professional lives. I also take this opportunity to thank the Indian Association of Mozambique for inviting me here on this auspicious occasion and place on record my commitment to support and work with them in the times to come. I wish them all the very best as they continue with their extremely laudable activities for the good of the Indian community in Mozambique. Thank you very much and Jai Hind.